Dr. Larry Santora. Thank you for watching Heart, Health, and Home. Today we're going to talk about elective procedures in the COVID era. My first co-host, Nikki Johnson, is going to talk about Medicare insurance in the COVID era. She'll be followed by my other co-host, Mary Sanchez, who will talk about real estate in the COVID era. And then I'll be talking about elective procedures in the COVID era. Thank you for watching today.
Hi, I'm Nikki Johnson, a health insurance agent specializing in Medicare. Medicare can be confusing, so I'm here to assist people with questions about Medicare and how to navigate the system when they first turn 65 or when they're retiring and coming off an employer plan and applying for Medicare for the first time. And even for those people who have been on Medicare for many years but want to compare their current benefits and update their current plan. Today, I want to discuss Annual Enrollment Period, also known as AEP. AEP is an election period every year that runs from October 15th to December 7th. You may have seen an advertisement on the TV or something in the form of a mailer come to your house about this. During this time, you can join or change your Medicare Advantage plan, as well as join or change a Part D prescription drug plan. The changes you make during AEP will take effect January 1st of the following year. As a licensed independent health insurance agent, I can assist you over the phone, in person at your home, or in person at our office locally. Of course, in light of the current COVID-19 situation, almost all health insurance companies have installed remote enrollment, so we can safely work together without having to be face-to-face. Working with a broker or agent like myself takes the stress out of reviewing each plan and their new benefits each year on your own. It also helps to make the information more manageable, and best of all, my service is at no cost to you. Also, I become your agent for the entire year, so any questions or issues that come up along the way, I'm always available to help. If you or you know anyone else who could benefit from a phone call with me, feel free to forward my information. If you have any questions or concerns, as always, feel free to email, call, or text me at the number listed below on the screen. Until next time.
Hi, my name is Mary Sanchez, and I specialize in residential real estate here in Orange County. I am with Coldwell Banker, and I wanted to talk about four great reasons to consider buying a home today instead of waiting. My first reason is that prices will continue to rise. CoreLogic's latest home price insight report shows that home prices have appreciated by 3.6% in the last 12 months. The same report predicts prices will continue to increase by a rate of 5.8% over the next year. My other reason would be that mortgage interest rates are projected to increase by next year. The primary mortgage market survey from Freddie Mac indicates that interest rates over a 30-year mortgage have recently just hovered over at 3.5%. This is great news for buyers in this market right now because it gives them buying power. The Mortgage Bankers Association, the Fannie Mae, the Freddie Mac, and the National Associations of Realtors are in unison, projecting that rates will increase by next year this time. With that said, as we know, an increase in rates will impact the monthly mortgage payment. Thirdly, either way, you are paying a mortgage. Everyone needs to understand that unless you're rent-free, you are paying a mortgage, either yours or your landlord's. As an owner, your mortgage payment is a form of forced savings that allows you to tap away at any equity that you may have when you need it, and whether it's currently or later in life. And as a renter, you guarantee your landlord is the person with the equity. And for this simple reason, now is an advantageous time to put your housing costs to work for you. And lastly, sometimes it's just simply time to move on with your life. The cost of homes are determined by two major components: the price of the home and the current mortgage rate. It appears that both are on the rise. Bottom line, buying a home sooner rather than later could lead to substantial savings, and which will empower you to have an equity which you can tap into later in life. If you'd like to connect to determine if home ownership is the right choice for you and your family, please feel free to contact me, and I will be happy to help in any way I can.
Heart Health at Home. I'm Dr. Mary Santora. Thank you for watching Heart Health at Home today. I'm going to talk about elective procedures in the COVID era. When hospitals cut down the admissions for elective procedures, they did not do that to protect people from getting an infection when they had the procedure. They did that to free up beds so patients who were sick with COVID would have a hospital bed to go to. Then they released the beds, and now we can do elective procedures in most parts of the country, but patients are now afraid to come in to get these procedures because they think they're going to get an infection in the hospital. When you come in for an elective procedure, it's very, very unlikely you're going to get an infection from COVID, because not only are you screened, like all surgical patients for COVID, you're put in a special part of the hospital where surgery procedures are done. The staff is usually gowned. Sterile procedures are very, very important. And you're in an operating room or suite, which is very sterile, and the chance of getting a COVID infection is very, very slight. Plus, we tend to get you out of the hospital in 18 to 24 hours or even sooner than that. Now, some procedures like orthopedic procedures, like you have knee pain and you want to get a total knee, you can wait 6 or 8 weeks without any harm. But if you have a herniated disc in your neck and you're impinging on the nerve and you're going to lose nerve function, that is not an elective procedure. Now, for heart procedures, I don't think any of these are really elective, because we don't know what the consequences are if a heart condition is left untreated. One of the most common things that we treat are blocked arteries, the coronary arteries. These are on the outside. And if you're having chest discomfort or you have an abnormal stress test, you usually need to have an invasive angiogram. The invasive angiogram I usually can do right through the artery in the wrist here with a little sedation and local anesthetic, and put the catheter into your arm, up to your heart, take pictures of the arteries of the heart in about 30 minutes, and send you home in 2 hours if I don't need to fix anything. If you have a severely blocked artery, I can put a stent in. A stent's a little coil like this. It's a slotted tube. This is for a leg, but the arteries in the heart are much smaller, like the size of a lead pencil. But we can do this and put this in about an hour and send you home in about 12 to 24 hours. Another most common procedure is a pacemaker. A pacemaker is used for a slow heart. And this is a little battery that's put under the skin, under the collarbone. Takes about an hour. You can go home in 12 hours to 24 hours. Again, sterile conditions, very unlikely to get COVID. Another condition that we commonly treat is narrowing of the aortic valve. This is the main pumping chamber of the heart, and this is the valve, the aortic valve, that goes to the heart, the head, and out the rest of the body. If this becomes very narrowed, then this pumping chamber cannot pump blood out to the rest of your body, and you can pass out or die suddenly. We have a way to put this type of artificial valve in through the leg. It takes about an hour, and you're home the next day. This is for aortic valve stenosis. Stenosis means narrowing of the aortic valve, and the procedure is called TAVR, trans-aortic valve replacement, TAVR. And we say trans-aortic because it's going through the aorta, through the artery in the leg, up to the top of the heart. So this is put in. The old valve is not taken out, so you don't have to open up the chest. And you just put this through the old valve and open it up with a balloon, and you can go home in the next day usually. So if your doctor tells you that you need a pacemaker, if he tells you that you may need an angiogram or a stent, if he tells you that you need a valve replacement, do not be afraid to have these done. These can be done in a safe manner. You won't get an infection in the hospital. But think of it this way. If you have a narrowed aortic valve, if you have a blocked artery, if you have a slow heart rate that needs a pacemaker, and you do get COVID, you will have a very hard time surviving COVID because your heart is put under tremendous strain with the infection and may not be able to handle the strain of the COVID infection. So in my mind, elective procedures are not usually heart-related procedures. Follow your doctor's advice, but do not put it off because you're afraid. Ask them questions, but you should tolerate the procedure well without having a COVID infection, and it could possibly save your life. Thank you for watching today. I'm Dr. Larry Santora. We'll see you in a week. Thank you. Thank you for watching Heart, Health, and Home today. We would like to send you this book. It's a complimentary. It's a book that I wrote about coronary calcium screening, which is a way of picking up plaque or calcium in the coronary arteries. I think it is the most important test that we have in medicine today, and this book will explain the whole process. It also talks about other aspects of heart disease. Along with this book, we want to send you this cloth mask. They come in various colors. This is the one that I tend to wear. It's very breathable, and you can talk through it. You don't feel like you're smothering. It covers a lot of your face. It's washable, and we will send you one of these along with the book if you request it through hearthealthandhome@yahoo.com. And also please press our subscribe button. Thank you for watching, and we'll see you next week. I'm Dr. Larry Santora, and this is Heart, Health, and Home.